Hi everyone, today I am talking about Botox because there's a date coming up which you were probably happily unaware of. I certainly was until I was asked to write an article about it, which is that it's 15 years since Botox received approval from the American FDA for cosmetic use. So for this article I've written about why that approval was such a big deal and about my experience with Botox over the years, so I thought I would vlog it too. And yes, I have had quite a lot of Botox over time, and I know my face is fairly wrinkly and mobile at the moment, but that's because I haven't had any for a while, except for half a forehead full about 6 weeks ago. And yes, that was only half a forehead full, and that was for a different article. And goodness me, the things I do for work. But if you're thinking, hang on, hasn't Botox been around for a lot longer than 15 years? Well, you are absolutely right. It is a prescription drug, and it was used in the 1980s to correct squinting and eyelid spasms, because how it works is it temporarily stops muscles from being able to contract or go into spasm. So by the 90s, doctors and dermatologists were experimenting with how it might work to damp down the muscles in the face that make wrinkles, the muscles that lift the brow into furrows, or the muscles that scrunch up the skin into crow's feet, and particularly the muscles that draw the eyebrows together to give vertical frown lines. And I started hearing whispers about Botox when I started writing about beauty, which was the late 1990s, and it was all rather hush-hush. Not that many doctors were using it, and it's quite hard to remember now, but everyone was completely horrified by the idea that vain women were resorting to injections of what the papers like to call a deadly poison in order to stave off the aging process, and were often ending up looking strangely waxy and frozen as a result, because early Botox was not subtle. I was talking to Dr. Tracy Mountford about this recently, and she is one of the first cosmetic doctors in the UK to use Botox. And she pointed out that in the early days, the protocols were all about using heavy doses to get total smoothness. It was about chasing the line, or rather chasing away the lines. And people were really alarmed by it, because Botox is made from botulinum toxin A, and botulinum is the most lethal toxin there is. It's a nerve poison. But as with any substance, what makes it poisonous is the dose, and the amounts of the toxin you get in cosmetic doses of Botox are absolutely tiny. They're not going to poison you. And if I tell you that it's also been used for decades to reduce muscle spasms in children with cerebral palsy, and it takes about 10 times the quantity you'd have in a cosmetic dose to stop a child's limb from spasming, that might put it into context. But back to faces. By 2000, turn of the century, I was a bit baffled by Botox, because public opinion was hugely against it and everyone was very fearful. But at the same time, I was interviewing doctors who were using it every day, and they're delighted patients who just couldn't get enough of the stuff and who clearly didn't have any problem with it. And I found a piece from the Evening Standard, which I wrote with a colleague in 2000, with a quote from one woman saying how she would rather miss a dentist appointment than her Botox jab. Possibly that is the wrong thing to compare it to, because a lot of us wouldn't mind skipping a visit to the dentist, but you get the point. And when the FDA approved Botox, it was a really big deal, because it was the first time a prescription medicine had been approved for cosmetic use. And while the FDA rulings don't govern UK doctors, it made the whole thing seem much more official, much more okay, if you like. So I didn't get round to trying Botox until 2004, by which time I certainly needed it, because I was 41 then, and I went to a doctor recommended by a friend. But it wasn't a brilliant success, because he whacked large doses of it straight across the middle of my forehead, and I got these big red marks, and I was on my way into the office and I'd forgotten my makeup bag, so I had to dodge into the nearest shop that sold makeup to grab their testers and cover up the damage. And then when it did settle in, it just left me with a completely blank forehead. I couldn't move anything, so I ended up having a fringe cut to hide the evidence. So that wasn't brilliant. But, I was constantly talking to doctors and dermatologists and surgeons who were all using Botox, and they were all often offering to treat my face. And every now and again I would weaken and say, okay then, go on, show me what you can do. And sometimes it was great. I'd look fresher and more rested. And I always love the way it smooths away the sort of stress and tension from the face. But then I hate it if I can't move my face at all. And certainly 10 years ago, even, it was quite hard to find someone who could do that happy medium where you look fresher, but you don't look fake. But now, you could say that Botox has come of age, and although there are still a lot of doctors who are doing bizarre and over-enthusiastic work with it, shall we say, the majority all aim to give people a natural look with minimal doses just to relax those muscles that cause the dynamic wrinkle lines rather than actually freeze them. And they all know how to use Botox to balance up a face too. Say if you've got one eyebrow that's higher than another, or if like me you tend to do that and pull down the corners of your mouth a lot, a couple of shots in these muscles here will reduce that. Or if you grind your teeth, it gives you a very square jaw, and a bit of Botox in the masseter muscles here can soften that, and it also can make a square jaw look a bit more heart-shaped. And yep, I've tried all these things over the years along with Botox in the neck, because if your neck is looking tight and over stringy, it can relax those muscles and makes it look better. So I have had a lot of Botox over time, but two great things about it are that A, it works, and B, it is temporary. It wears off over 2 months, 4 months. It depends how much you've had injected and how strong those muscles are. And I like to let it all wear off because I go and have more, just to remind myself what I look like without it. And because I know, like with fillers and lasers and all the other cosmetic procedures, it can be a slippery slope, and it is not hard to end up looking a bit too done. And because I'm writing more than ever about non-surgical procedures like Botox, I am always bumping into the doctors and surgeons and dermatologists who use it. I'm interviewing them at their clinics, or I'm meeting them at industry conferences where you see a lot of very weird faces. And they all say that what everyone wants is to look natural and normal. And they've got so good at it that most of them know exactly how to do that. And then we have a laugh about the supposed Botox backlash. There is no backlash. All those people, particularly celebs, who swear they've given up on Botox, they are just getting such good, subtle work that it's really hard to spot. They're getting what Dr. Seabag, who's one of the best known names in this whole business, is what he calls actor Botox. So patients can make all the expressions they need, they just aren't so exaggerated. So what do I have done now? Well, for the past year, I've been seeing Dr. Tapan Patel at the Phi Clinic, who is brilliant and also quite cautious. And he sprinkles a bit of Botox around my face where it's needed, and I always go back 2 weeks later so he can see how it's settling and make adjustments if necessary, because it often is. And I'll add in the video here of me having some treatment with him from a few months ago if you want to see what an appointment looks like, how many injections I get. And I know the big question for anyone who's interested in Botox is, who do I go and see? And the best answer is someone you have a personal recommendation for, or someone who is registered with the BACM, who I'll put down there below as well. I'll also put in a list of the doctors who have given me great Botox over the years and others who I know who do really good work. I mean, it's only the tip of the iceberg. There's so many people out there, but I hope it's helpful. So let me know what you think. Stick any questions down below and I'll get back to you. And I hope you enjoyed it. Clinic with Tapan Patel. Hi. Having a spot of Botox, and you're going to do a bit on the forehead today?
Absolutely, a little full face treatment actually.
Full face treatment,
So
okay.
the way we're going to do it, we're going to use small amounts of Botox to give you a much more natural look.
Fab.
So you maintain some expression, but it just blunts the lines rather than removing them completely.
Okay, lovely.
It's just frown for me like you're angry and relax completely. And then raise your eyebrows as high as you can. Now turn this way for me. Give me a smile.
The crow's feet.
That's the ones.
Yeah.
Now look this way. Good.
I do scrunch up a lot around there.
There's an interesting muscle down here to treat. If you just frown for me. No, I'm sorry. Turn the mouth corners down. There we go. That's it. And relax for me. So this is a very interesting muscle to treat because, in fact, a lot of people, without realizing it, turn the mouth corners down, and the net effect that has is it enhances your ability to blunt the jawline. So by treating that muscle, we keep the jawline nice and sharp.
Because I hadn't really realised I did that a lot until we were chatting one day and you pointed it out to me.
Yeah,
So I've been quite self-conscious about it since then. Of course, I do it far more, possibly as a result of realising that it's one of the default things. You know, some people pop their eyes when they're surprised by something or purse their lips, and I find I do that.
Yeah, and we've spoken before about the fact that there's treatments and there's tweakments, and I think this is one of the very nice little tweakments that we can do to avoid excessive treatment in that area. So what I find it does is it just keeps the jawline nice and youthful, it keeps it nice and fresh, and there's a lot of people who that's all they will need, just a little injection of Botox just to the sides of the chin.
Terrific.
And we can again, review you after that. So.
Yeah. And do people dispose, or does their body use up the Botox faster depending on their metabolism? Because I know that's how it works with fillers. Is it the same with Botox? Or
it's difficult to just put it down to one factor.
Okay.
It's multifactorial. There's no doubt that there is a range.
Yeah.
Some people will find the Botox only lasts a couple of months, whereas for others it's 6. But 3 to 4 months is average.
Yeah. Also depends on how much you go and put in the first place, doesn't it?
Exactly. It is dose responsive, and therefore, if somebody wants a very frozen look, which I don't like, it's probably going to last a bit longer. We prefer a more natural look where you maintain some expression, and the downside of that is it does last a little bit less long.
Yes.
All right.
You can't completely have your cake and
That's
eat it.
it. You got it. So just relax for me. Okay, here we go. A little scratch. Well done.
It's so easy. I mean, there's no anaesthetic, but really, I can hardly feel it.
Well, that's right, and I think people sometimes who've not had the treatment get a little concerned when they hear that it's an injection, but it's worth remembering that the needles are tiny, and what we're doing is we're putting it in very specific places, tiny little doses, and the idea is that therefore what we should find is that you get a nice overall balanced result, and my philosophy has always been that we can add more in. We can't take it out.
Okay.
So what I always do is put a small amount in, then I can review you, and we can decide if that's about right or not. Okay, it's the upper bit done.
Thank you.
And now I'm just going to do the sides of them. And the other side.
Tiny pinprick, I can feel that down there.
For some reason, it's a little bit more obvious lower down in the face.
And now in the chin, you do that to stop the bunching up?
Correct.
Of the chin?
So the chin is a very active muscle, and when we activate that, exactly when you do that, you can sometimes see almost what we call cobblestoning. And over a period of time, that actually changes the skin texture.
Yeah.
So when I notice that somebody, as part of their normal expression, is making a lot of use of their chin muscles, I like to soften that, and over time what that does, it keeps the skin nice and soft in balance with the rest of the face.
Okay.
Now we'll treat these little things around the eye. Little scratch.
It's such a tiny scratch. I find when I'm writing about treatments and the girls who commission me say, so what's the pain factor? 1 to 10. And for something like this, I'd say, it's a 3 or a 2. It's nothing. And they laugh and say, yeah, but your 3 or 2 is probably like 5 or 6. And it's very hard to convince them otherwise.
That's right. But I think
so tiny pinpricks, which you can see them now, but I know in a few hours.
Probably not even a few hours, probably 20 minutes
20
probably.
minutes,
There'll be no real evidence that you've had anything done.
Yeah, I'm off around town now, and people are quite used to me turning up for meetings, looking like I've run into a sharp needle or two. Anyway, thank you very much.
It's an absolute pleasure.